Ezpay, HealthEZ's medical payment service, was designed to simplify healthcare transactions between patients and providers. HealthEZ was founded in 1997 and was designed to eliminate all the paperwork and confusion associated with the healthcare billing and payment process. We are the only company in the country who generates a simplified statement for the consumer and a consolidated check and explanation of payment for the provider. We recognize that each needs different information, and the industry has always sent the same EOB to member and provider. When HealthEZ was launched, we mapped out all the steps a claim can travel through in order to get paid, and even we were surprised with how many steps are included. Step 1 begins with the patient visiting the provider for care. The rest of the steps are a complex accounts receivable system. Healthcare is unique in that there is a business-to-business transaction followed by a business-to-consumer transaction. Once you receive payment from the member's insurance, you start the process all over to collect the remaining patient liability. HealthEZ cuts into the process on the back end, reducing the need for you to bill and collect from the patient after the plan or insurance portion of the claim has been paid. It was designed to be a post-adjudication process. Nothing changes on the front end. Claims are submitted in the same way as before. HealthEZ's proprietary financial management system consolidates the transactions after the claims are processed, creating a consolidated check and explanation of payment across all employer groups and patients. Patient liability is added to the plan or insurance portion of the payment wherever possible. Ideally, you send just one bill and are paid in full before the next billing cycle. Our members give us access to various accounts from which we pay patient liability, eliminating the need for you to determine how much to collect at the time of visit. Many plans are no longer copay plans, and it is difficult to know what to collect up front. Our members can have up to 5 accounts on file, including credit and debit cards, HSA, HRA, and Flex accounts. Our agreement is one page. It is not a managed care agreement. If we pay you in full, we deduct a small fee. If we aren't able to pay you in full, there is no fee, and you collect from the patient as you normally would. It is very simple to terminate our agreement, but, in fact, no provider has ever terminated because they realize that we do what we say we do. HealthEZ offers numerous benefits on behalf of our members, simplifying and streamlining your administration. We can't solve all of your problems, and we wish we could deal with Medicare and Medicaid patients, but we can help you with a small part of your business, and hopefully it will grow. Even with rising healthcare costs year over year, the vast majority of claims are still under $1,000. This chart is based on actual claims, including facility charges. Providers look at our fees in aggregate, and even with higher dollar claims, the benefits far outweigh the fees. Providers are considered a client of ours, just as employers and members are considered a client. HealthEZ's innovative service greatly reduces your administrative cost. You generate just one bill and get paid in full wherever possible. Perhaps you do a great job of collecting, but how many bills are sent out before you are paid? HealthEZ also absorbs all credit and debit card processing fees. Plan payments are expedited, and if we cannot pay you in full, even if we're $1 short, there is never a fee. This chart describes how the process works administratively for both our members as well as our providers. Once the claims are adjudicated, an electronic file is sent to our proprietary financial management system, where transactions are consolidated and member payment accounts accessed. Our consolidated statement is issued for HealthEZ members and their dependents, eliminating single explanation of benefit forms that the industry issues to patients and providers when each party needs different information. In the case of a simple fracture, the member can receive numerous bills from providers they didn't even know they saw and whose names they may not recognize, such as the anesthesiologist or radiologist. Our statement consolidates these bills. It is simple and easy to read and shows our members if we paid on their behalf or if they owe their provider and what that amount is. Most consumers are confused by all of the paperwork that is generated in the healthcare industry, provider bills that don't match up with our EOBs. Members who are confused and who may not be able to cash flow their expenses will pay providers last because historically there have been few consequences. HealthEZ solves both of these issues. These are some of the most frequently asked questions and answers. This map depicts the various markets HealthEZ operates in, including markets where we have more concentrated business. The number of providers we have under contract is a testament that the service works, and we launched this successfully when most plans were copay plans. Today, with all the consumer-driven plans, our service is even more valuable to providers.